We just learned about the importance of observing and acting on a resident's change in status as part of the age-friendly approach to healthcare. In this video, I'm going to show you how to make a mental health action plan that will help you measure your current functioning, recognize changes in your own status, and make plans to take care of your health and well-being. You make a big difference in delivering age-friendly care, and you matter too. Let's face it, our lives are busy. We've talked about the importance of stress management and work-life balance, but sometimes we are too busy to make self-care a priority. Sometimes it's good to think about your life and make sure that you're taking care of yourself, physically and mentally, because self-care can go a long way to help your well-being. It's important to remember that you have to take care of yourself first in order to take care of others. In this video, I'm sharing a mental health action plan from our friends at the University of Kansas School of Nursing to help you focus on your own well-being. This plan will help you recognize when you are in the safety zone, the caution zone, or the danger zone. It offers helpful tips and reminders about steps you can use to protect your well-being by focusing on self-care activities that matter the most to you. Just like you monitor residents for change in status, the sooner you are able to recognize how stress is affecting you, the easier it is to put a self-care plan into action. If you are in the safety zone, now is the time to write down the steps you are taking to protect your mental health and well-being. Do you regularly connect with your support system, like family and friends? Do you make time for exercise or meditation? Are you getting quality sleep most nights? Pay attention to what you're doing and what works for you. Do your best to prioritize the things you are doing for self-care and try to get back into your healthy routine as soon as possible if something interrupts your schedule. If you find that you are in the caution zone, it is time to look through the steps on the back of the assessment. Make a plan to increase your self-care activities on a regular basis. It might be a good idea to talk with a family member, friend, or coworker who will support you by reminding you to take care of yourself. It's amazing what small adjustments to your daily life or weekly self-care routine can do to improve your overall health, well-being, and energy level. Review the action plan regularly and keep adding self-care steps until you are in the safety zone. Pay attention to the self-care steps that are most helpful to you. Those are the steps you should start with if you find yourself in the caution zone again. If your assessment shows that you are in the danger zone, it is time to hit the brakes. Full stop until you have a plan to address your personal health and well-being. The danger zone includes signs like feelings of depression and hopelessness, not enjoying activities or interactions you once enjoyed, difficulty with concentration, feelings of isolation, fatigue, feelings of shame, or even thoughts of hurting or killing yourself. Even though working to improve your self-care can help relieve some danger zone symptoms, now is the time to consider involving others to support you. Think about making an appointment with your primary care provider or behavioral health specialist. Just like the residents you serve benefit from your nursing skills, being in the danger zone suggests that you might benefit from medical or behavioral health interventions. It's also important to seek family, social, and employment support, such as employment assistance programs. If you're in the danger zone, the most important goal is to get out. And involving others, family, friends, employers, healthcare professionals, in your self-care plan is often the best strategy for getting back to the safety zone. You can use this plan as often as you'd like, monthly, weekly, or daily, as a way to check in with yourself and make your self-care a priority. Even though using this tool might seem like one more thing to do, especially if you are busy, keeping a regular check on your physical and mental health is a great way to manage stress and respond to changes as soon as possible. And Having a plan that works for you is always good to have on hand. If your life suddenly becomes more stressful or demanding, having an action plan on hand that you know works for you is a great resource and stress reliever. The work you do is essential, and it's so important for you to check in on yourself and have an action plan to take care of your own health and well being. Remember our motto: what is good for the resident is also good for daily caregivers. Residents are unlikely to get high quality care if the person caring for them, you, their daily caregiver, is stressed, burdened, and feeling frustrated throughout the day. It's important to pay attention to your functioning, recognize when you experience changes, and have a plan to support your health and well being.